Hello, you're watching The Wire, and this is the daily COVID-19 update bulletin. People from across the country observed the Janta curfew today. Here are some visuals of how deserted the streets were in the morning. At 5 p.m., people showed up outside their homes or in their balconies at the request of the Prime Minister in order to pay gratitude to all employees providing essential services. The private laboratories will now be able to test for COVID-19 under guidelines issued by the ICMR. The COVID-19 tests in the private lab can be done after a prescription of a qualified physician as per the ICMR guidelines. The ICMR has recommended private labs that the cost of testing should not exceed 4,500 rupees. It has also encouraged labs to conduct free or subsidized tests in the time of a national public health emergency. Under the guidelines issued by the ICMR, they have said that private labs preferably should undertake home collection samples, which will avoid contact of suspected people with others. It has also recommended that the test results of each case should be shared with the ICMR headquarters in real time for appropriate control measures. To read more about this, you can log on to science.thewire.in. 75 districts across the country, including the capital city New Delhi and the state of Maharashtra, will be on complete lockdown under March 31, barring essential services. Section 144 has been imposed in New Delhi and in Maharashtra. Delhi has also closed its borders. On Sunday morning, a high-level meeting of the Cabinet Secretary and the Principal Secretary to the Prime Minister was held with the Chief Secretaries of all states to discuss the need to extend movement restrictions across the country beyond Sunday. These essential services that will remain operational will include medical stores, water and electricity supplies, and provisions for food. All train services will be suspended till March 31, including suburban or local trains. All metro services, along with interstate passenger transport, will also be remain suspended till March 31. On Saturday evening, there was a crowd swell at the Mumbai and Pune train stations. These were migrant workers struggling to return home, as all non-essential services like construction sites, tanneries, garment shops and small hotels have been shut in Maharashtra. Daily wage workers were fleeing joblessness, they told our reporter Sukanya Shanta at Thane. One such person was a security guard who could not go to work because all malls are shut. His employer informed him that he will not be paid until situation improves. He was returning to Bhilwara with his family. As the crowd kept swelling at the Mumbai and Pune stations, Railways had to add 17 special trains to the existing 47 scheduled trains for people to return home. On Sunday, the Kejriwal government in Delhi has announced a slew of measures. He announced free rations and double pensions for 72 lakh people in Delhi. In addition, he also urged all employers to provide paid leave, including to domestic helps. In a Facebook post, a senior doctor from Hyderabad, who is also the leader of the Backward and Minority Communities Employee Association, or BAMSEF, has said that instead of clapping and showing gratitude to health workers, as responsible citizens, she wanted Indians to demand from the government certain monetary measures to combat this crisis. For example, she said that she wanted the citizens to ask the government to spell out the allocation of disaster relief fund for all, or getting the government to push at least double the amount of funds required for the Sardar Patel statue. 263 evacuees from Rome were brought to India in a special Air India flight and have been quarantined at the ITBP center in New Delhi's Chawla for now. The total number of cases in India stands at 341, with 7 deaths so far. The death of a 38-year-old man from Munger in Bihar and that of a 69-year-old man from Vadodara in Gujarat were reported today. To read more news and analysis, you can log on to thewire.in. Thank you for watching. See you tomorrow.